بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Hello everyone, welcome again to Ziada Academy, and this is Dr. Hussam Ziada, Associate Professor of Ophthalmology, Head of Cornea and Refractive Unit at Al-Azhar University Hospitals, Cairo. And today's lecture is for my dear students, undergraduate students, and also for my dear colleagues, postgraduate students, because it's very important for all of us, because it is one of the commonest signs in ophthalmology, which is the red eye. The red eye is a common presentation for a group of ocular diseases and also for another systemic diseases, all these ocular diseases range from simple to major diseases. So we have, all of us, we have to know the differential diagnosis and approach to diagnose the disease underlying this red eye presentation. So firstly, we have to divide the red eye into two categories. The first one is painless red eye. The second one is painful red eye. And today we'll start a series about the painless red eye causes. Let's start. This is the first one in differential diagnosis of the painless red eye. It's one of the common presentation, which is the subconjunctival hemorrhage. The subconjunctival hemorrhage simply it's a patchy red sector of the eye, which may be focal or may be diffuse, covering all the wide of the eye. So it will be with a horrible appearance, but at the same time, it is very simple and with no danger for the eye at all. So the common presentation for the subconjunctival hemorrhage is usually as an acute asymptomatic, hence this word asymptomatic redness. So it can produce a gritty feeling in some cases because of the elevated conjunctiva, which may cause gritty sensation like foreign body sensation. The conjunctival hemorrhage can be small, discrete, or diffuse. As you see in the picture above, is diffuse and patchy or focal in the picture below. Causes can be, the causes of the subconjunctival hemorrhage could be trauma, suddenly rising intrathoracic pressure, lifting heavy weights, or coughing or sneezing, or the only local cause, which is the rubbing of the eye or direct trauma to the eye. The systemic causes, such as the vascular abnormalities or deficient vitamin C. Also, the risk factors include the hypertension and the anticoagulants and antiplatelets therapy. So patients who are on the anticoagulants and antiplatelets for protection against thrombotic problems or complications, like in the cardiac patients and the patients with past history of cerebrovascular strokes or thrombotic problems and like DVT, so they are on the anticoagulants and the antiplatelets and may complain of recurrent subconjunctival hemorrhage. So the development of subconjunctival hemorrhage can therefore be an indicator of underlying issues such as uncontrolled hypertension or dearranged coagulation. And because it's asymptomatic, because it's not related actually to the eye itself, so the management is not, there is no typical management is required. There is no typical management required for this problem. It's self-limiting problem and could be corrected spontaneously and resolved spontaneously without any medications. Actually, myself, I don't describe any medications for the subconjunctival hemorrhage, just doing reassurance for the patient advising the patient to know about the systemic problems, to measure the blood pressure, to avoid sneezing, straining, and so. At the same time, if this patient is on anticoagulant or antiplatelet therapy, I ask a patient to go back to the cardiologist or to my colleague who is responsible for treating of this patient to help adjusting the dose of the anticoagulants or antiplatelets if possible, with no risk for the life of this patient. Lubricants may be prescribed if there is gritty sensation. Actually, this patient feels nothing, just frightened when he looked to the mirror and suddenly found this red patch, and he will come to your clinic so scared about this horrible appearance, or may the neighboring people who told this patient about this red patch or red appearance of the eye. So their assurance, the mainstay for this problem, and tell him that the hemorrhage will resolve over a few weeks with no worry at all. But if this subconjunctival hemorrhage is secondary to trauma, you should to consider the possibility of presence of a foreign body in the eye, especially if there is pain, if there is watering, if there is reduced visual acuity. You have to check the eye pockets, superior fornix, inferior fornix, medial and lateral angles of the eye carefully to exclude presence of the foreign body. If present, you have to remove it and give this patient the proper treatment for if there's corneal scratches or an infection associating the presence of this foreign body. And so we have to mind finally that the subconjunctival hemorrhage is one of the causes of painless painless red eye. But in the mind, it is patchy red spot, sector, or diffuse covering of the apparent part or apparent white of the eye, with no problem, mostly related to a cause out of the eye, will resolve spontaneously with no worry at all. Thank you so much, and see you soon in the coming lecture about the second cause of the painless red eye. See you. Assalamu alaikum wa rahmatullah.